Today, we're focusing on weeks 12 and 13 of your pregnancy. This is a really exciting time because your baby is developing rapidly, your symptoms may begin to shift, and you're about to enter your second trimester. In this video, we'll cover fetal development, pregnancy symptoms, what your body is going through, what to expect at your prenatal appointments, and practical tips to feel your best. Plus, we'll answer some frequently asked questions and myths that pop up during these weeks. Make sure you hit that subscribe button and tap the bell so you don't miss your weekly update. Section 1, Fetal Development Week 12. At week 12, your baby is officially in the fetal stage. Most of the foundational work is done, and now your baby is focused on growing and refining the systems already in place. At this point, your baby is about the size of a lime, measuring around 2 to 2.5 inches and weighing just under half an ounce. Key milestones this week. 1. Major organs are formed and beginning to function. 2. The brain is growing fast, especially the cerebral cortex. 3. The intestines, which had been developing outside the body, are moving into the abdomen. 4. Reflexes are starting, your baby can open and close their fingers, curl toes, and even make sucking motions. 5. Bone marrow is starting to produce white blood cells. 6. Eyes and ears are nearly in their final positions. 7. External genitalia is forming, though it's still early to accurately determine sex on ultrasound. Organ development highlights. 1. The kidneys are starting to produce urine, which will become part of the amniotic fluid. 2. The liver is beginning to produce bile. 3. The stomach is producing digestive enzymes. 4. The pancreas is forming insulin. 5. The heart is fully formed and beating strong, around 120 to 160 beats per minute. If you've had a first trimester ultrasound around this time, you may have seen your baby doing flips or moving around. It's an exciting moment. Section 2, Pregnancy Symptoms at 12 weeks. By week 12, some symptoms may begin to ease, but for others, they may linger. Here's what many women experience. 1. Fatigue may start to lift as hormones level out. 2. Morning sickness could start easing up for many, though not all. 3. Hormone-related headaches may begin due to estrogen and blood volume changes. 4. Digestive changes like constipation and bloating may increase. 5. Vaginal discharge may increase. This is normal unless it has a strong odor or is accompanied by irritation. 6. Your uterus is growing and may now be just above your pubic bone, you might even see a tiny bump. This is also a time when emotional shifts can happen, you might feel more excited, anxious, or both. That's completely normal. Section 3, Fetal Development Week 13. Welcome to week 13, the final stretch of the first trimester. Your baby is now around the size of a lemon, about 2.9 inches long and close to 1 ounce in weight. What's new this week? Vocal cords are forming. The head is still big but becoming more proportional. Bones are hardening, especially in limbs. Organs like the liver and pancreas are functioning. The stomach is developing more fully and beginning to practice digestion. Kidneys are producing urine that is released into the amniotic fluid. The intestines are starting to practice contractions known as peristalsis. The spleen is producing red blood cells, taking over some of the liver's job. Your baby is learning to swallow and may even be urinating into the amniotic fluid. Lanugo, the soft peach fuzz hair, is forming to help regulate temperature. The placenta is now fully functional, producing hormones and delivering nutrients efficiently. This also means your risk of miscarriage drops significantly after this week. Section 4, Pregnancy Symptoms at 13 weeks. As you approach the second trimester, many moms-to-be notice a surge in energy and overall well-being. Common symptoms: increased hunger, your baby is growing quickly now. Stretching or pulling sensations in the lower belly due to round ligament pain. Some women experience acne or pigmentation changes. You might feel more emotionally stable, or still feel emotional swings. Libido may return or even increase thanks to better blood flow and hormone changes. This is often referred to as the honeymoon phase of pregnancy. Use this time to prep for what's ahead, like maternity planning and scheduling prenatal classes. Section 5, Prenatal Appointments and Tests. At 12 to 13 weeks, you might have one of your most exciting checkups. This is often when you'll hear your baby's heartbeat with a Doppler. An NT scan is performed to measure fluid at the back of the baby's neck. Blood tests for chromosomal abnormalities are offered. Your provider may offer genetic screening like NIPT. Make sure you bring any questions with you. This is the perfect time to talk about nutrition, exercise, and emotional well-being. Section 6, Self-care tips plus lifestyle ideas. Your baby's thriving, and so should you. Here's how to take care of yourself this week. Prioritize hydration. Aim for 8 to 10 glasses of water daily. Eat nutrient-rich foods, think leafy greens, lean proteins, and whole grains. Move your body, gentle prenatal yoga or a short daily walk can do wonders. Moisturize your skin to reduce itchiness as your belly grows. Track your moods and symptoms in a journal, it helps you stay connected to your body. Start chatting or reading to your baby, bonding begins in the womb. Your physical and mental health are equally important during this stage. Section 7, FAQ plus common myths. Let's bust a few myths and answer some popular questions. Can I still exercise? Yes. As long as your doctor approves, light to moderate exercise is healthy. When will I start to show? For first-time moms, a small bump often appears around 12 to 16 weeks. Can stress affect my baby? Chronic stress can have effects, but daily worries are normal. Practice calming habits. Is it safe to travel? Generally, yes, during the second trimester. Always check with your provider before flying. Can I find out my baby's sex now? NIPT or early gender blood tests can be accurate by week 10, but ultrasound accuracy improves after 14 to 16 weeks. That wraps up our in-depth look at weeks 12 and 13 of pregnancy. Your baby is growing fast, your body is changing in amazing ways, and you're about to step into the second trimester with confidence. If this video helped you, give it a thumbs up, subscribe to Bump to Baby Life, and let us know in the comments where you are in your journey. We'll see you in our next video for week 14 and beyond. You're doing incredible work. Take a deep breath and celebrate how far you've come.